Hello everyone, in this video I'm going to help explain the four different stages or phases in regards to Medicare prescription drug coverage. Okay, there are four phases. So in this video I'm gonna go ahead and show you an example of how to look at these phases. So there's the deductible phase. Okay, the first phase is deductible. The second stage is the initial coverage stage, and the third stage is the coverage gap stage, and the fourth phase or stage is the catastrophic coverage stage. So here I'm looking at three different plans, and you notice during the drug deductible phase, in this plan I'm looking at, it says 150 exclude tier 1, 2, and 3. In the middle plan, it says drug deductible 350 exclude tier 1, 2, and 3. And then the third plan I'm looking at says a drug deductible 150 exclude tier 1 and 2. So I'll give you an example. Here you're going to see how that works. Okay. And I'm also going to talk about the initial coverage limits as well, which is 5,030. So you'll know exactly what that means. And then the catastrophic coverage limit is 8,000. You also will know what that means at the end of this video. All right, let's get to it. So here we are. Okay. So the four coverage stage of Medicare Part D program, the first stage, okay, I'm going to basically go over this word for word with you. So the annual deductible begins with your first prescription of the plan year. You pay the full cost of your prescription until your spending adds up to the amount of your deductible. So if your plan has a $0 deductible, you skip straight to the next stage. Keep in mind that some deductible may only apply to drugs on specific tiers, which means you may not have any deductible if you do not take any medication on those tiers. Any payment for your monthly premium or for medication on tiers that do not apply to the deductible are not counted towards reaching the deductible. So here's a great example. When I read this part here for you, it says, which means you may not have any deductible if you do not take any medication on those tiers. So that's a great example I'm going to show you. If we go back on this prescription here, it says 150, okay, exclude tier 1, 2, and 3, okay? And this middle plan says $350 deductible, exclude tier 1, 2, and 3. And this third plan says $150 deductible, drug deductible, exclude tier 1 and 2. So this was a great example, I think. All right, now we're going to also move to the next phase, okay, which is the second stage. All right, let's look at this phase here, initial coverage limit stage, which is 5,030. So let's talk about it. So here it is. Initial coverage begins immediately if your plan has no deductible, or when the prescription payment you have made equal your plan's deductible. Okay, so to go back, remember those plans here, they have different deductible. So if you were to reach your deductible in this, if you were in this plan, if you once you reach your deductible, okay, remember it excludes tier 1, 2, and 3. So if you are on those tier, if your drugs is under tier 1, 2, and 3 in this plan, you go straight to the initial coverage limit. Okay, so you don't have to worry about that 150. Okay, now the middle plan, if you were in the middle plan here, it says exclude tier 1, 2, and 3. So if your drugs falls under tier 1, 2, and 3, you really don't have to worry about that $350 deductible. Okay, if you're looking at that third plan here, okay, It says 150 exclude tier 1 and 2. So if you are taking a tier 1 and 2 and you are in this plan, you don't have to worry about that $150 deductible. So that means your coverage, your initial coverage limit start right away. Okay? And this is the phase that we're going to discuss here. So let's talk about that one. Okay? So it says initial coverage begins immediately if your plan has no deductible or when the prescription payment you have made equal your plan's deductible. All right. So your plan pays for a portion of each prescription drug you purchase as long as that medication is covered under the plan's formulary list of covered drugs. You pay the other portion, which is either a copayment, a set dollar amount, or coinsurance, a percentage of the drug cost. The amount you pay will depend on the tier level assigned to your drug. This stage ends when the amount spent by you and your plan on your covered drugs adds up to equal the initial coverage limit set by Medicare for that year. In 2024, that limit is $5,030. Your monthly premium payment do not count towards reaching that limit. It's very important to note that. Okay? So basically in 2024, once you reach, okay, the limit is 5,030. Okay? That's the initial coverage that you see here. All right? Now we're moving on to the third stage. All right? So here's the third stage, guys. This third stage is the coverage gap stage. Okay, the coverage gap stage. It begins when you and your plan have collectively spent 5,030 on your covered drugs. Okay, so once you and your plan have collectively spent 5,030, and if we go back to this screen here, so once you comparing your plans and you see this number, so once, okay, you and your plans, okay, let's go back here. Once you and your plan have collectively spent this 5,030, okay, on your covered drugs, okay, then you enter the coverage gap. All right. So not everyone will enter the coverage gap, also referred to as the do not hold. In the coverage gap, the plan is temporarily limited in how much it can pay for your drugs. If you do enter the gap, you'll pay 25% of the plan's costs for covered brand name drugs and 25% of the plan's cost for covered generic drugs. Keep in mind that while the percentage you pay for brand name drugs is lower, the price of that drug may be much higher than the generic option. Calculate the amount you would owe for each to see which one really offers the best cost saving for you. You exit the coverage gap when your total out of pocket costs on covered drugs, not including premiums, reaches 8,000. Okay? Your out of pocket cost is calculated by adding together all of the following: yearly deductible, coinsurance, and copayments from the entire plan year, and what you paid for drugs in the coverage gap, including the discounted amount you did not pay in that stage. Okay. All right. So let's go back now to the catastrophic. Okay. Catastrophic coverage limit is 8,000. So that's the next one we're going to talk about. Okay. So that's what it means here. So once you reach 8,000, okay, then you enter in the fourth phase, which is a catastrophic. Okay. So The catastrophic coverage begins when your out-of-pocket costs reach 8,000 on covered jogs. After your out-of-pocket costs total 8,000, you exit the gap and get catastrophic coverage. During this payment stage, the plan pays the full cost for your covered Part D jogs. You pay nothing. You will remain in this phase until the end of the plan year. All right. So I really hope this video explains to you what these means if you're comparing your plans by yourself, or maybe if you're an agent in the field and you want to learn more about this. So hopefully this video helped. Okay. This was Jean Noel, independent insurance broker here in the state of Florida, and I'm also licensed in many other states in the country. As always, if you're looking for a independent insurance broker to go over your plan options, comparing your plans, I can help you if you're 65 and over and on the Medicare. Um, I can help you go over your plan options. I can help you with Medicare Advantage, Medicare prescription drug coverage, or Medicare supplement. Okay. Or if you need a free consultation on what to do and you're new to Medicare, I can also help you as well. If you are under 65, I can also help you find plans uh, through the marketplace or the Affordable Care Plan as well. So I'm always one call away, guys. You can always call me at 561-770-1298. You can go to my website, iQuoteMedPlan.com. All you have to do, guys, is fill out this form and it's going to come straight to me. And then that way I can reach out to you and see how I can help you. Okay. So thank you so much for watching. I'm trying to also build a community here on YouTube, Facebook, TikTok. So if you're watching this video on any of those platforms, feel free to follow me, like, subscribe, so that when I post new videos, you will be notified. Thank you so much again, and have a great day, guys. Peace. Bye bye.